Dr. Deb Schreiben here. What's healthy? We are! I'm super excited. I have some really cool topics to talk to you about today. And we're going to start out today by talking about weight loss. I know this is on a lot of people's minds because I'm getting phone call after phone call and email after email about, Dr. Deb, how do I lose weight? What am I supposed to do? In the beginning of COVID, we called it the COVID-19. Now we kind of jokingly laugh at it's the COVID-38. Those extra 19 pounds or 38 pounds. People are just gaining a lot of weight because you're so much more sedentary, and we are just, in these little home offices right next to our kitchens, and we're buying the comfort foods. So what do we do in my office to help people lose weight? If it's really just that you're eating too much and it's not an adrenal issue or a blood sugar issue or a thyroid issue or a micronutrient issue or a neurotransmitter issue, and it really is just a lifestyle issue, we have two different programs that we use. And a lot of people ask me, what's the difference, Dr. Deb, between homeopathic HCG and the prescription HCG? So I wanted to talk to you a little bit about the differences between the two and how they work and how successful we are with them, because a lot of people don't want to do a little injection. So the prescription form of HCG comes in injection form, and it's a teeny tiny little insulin needle, and you kind of go right around your belly button when you inject the HCG, but it is a prescription. And as we know with prescriptions, there are more side effects that can happen with a prescription. We do have a homeopathic form of it, a vitamin form of it, where the side effects are much less because there's much less of the HCG in it, and it's not the medication form of it. It is a little bit more sensitive because it is a supplement, and we do have to give you a little bit of a stricter regimen when we do the homeopathic form of it. But it still works incredibly well. When I did it, I actually lost 37 pounds in the first 6 weeks doing it. I never gained that weight back. And then when I started thinking about, hey, how are we going to bring in more weight loss? And when I added a medical doctor into my practice and a nurse into my practice and a full lab into my practice, I thought, hey, why don't we look at doing the medication form of HCG so my patients can have a choice? And so like everything else in my office, I like to do it before I give it to a patient to do. So my husband lost 42 pounds in a month. I lost 17 pounds, 17 additional pounds to the 37 pounds that I lost the first time. And I never gained it back. My husband didn't gain it back. And it's pretty incredible, those weight loss results. But one of the things that really sets us apart from other practices is, and one of the reasons why people, when they do weight loss programs, put the weight back on, first thing is, did they really bother to check and decide whether it's a weight issue, a lifestyle issue, or some other issue? So that's one of the things that we do different in the beginning. We'll talk about, do you have blood sugar issues? Can we look at some labs? Do you have thyroid issues? And if so, we got to repair gut and reduce inflammation and work on that first. And then we can do weight loss. If it truly is just lifestyle, we can jump right in, but the key is after. The key is after you've lost that weight, what are you going to do to change your lifestyle? Now, what we do is we teach you over the 3 weeks following the HCG weight loss period how to transition your body so that it says, hey, wait a minute, this weight feels really good and I want to stay here. And we teach you how to stay at that weight. And we do that with the homeopathic and with the medication form of our HCG programs. So we've had tremendous success with them. So if you're struggling with your weight and you know for sure it's a lifestyle issue, come on in. We can talk about it. We can get you onto an HCG weight loss program. We can talk about the two programs that we offer, and we can get you going with that. If it is in fact some other issue, we'll try to figure out what that issue is and resolve that issue and then do the weight loss for you. Oftentimes when we resolve a thyroid issue or a blood sugar issue, you lose weight anyway because your body starts to normalize. Weight gain is typically a symptom of something else going on, whether it's eating ding-dongs or yoo-hoos or yo-hos or whatever the ho-ho things are called, or just cookies or whatever it is, being too sedentary versus having a health issue. So let's look and see and figure out what it is. We have a question from Alexis, and this is about weight loss. So let me read her question to you. How do I couple exercise with HCG? That's a great question. We typically do not recommend you exercising heavy when you're doing HCG, because HCG weight loss programs are, yes, they are decreased calories, because what we're trying to get your body to do is transition to burning the fat off its body instead of burning the fat that you're consuming, right? Because fat that you're consuming is much easier to burn than the fat off your body. So we got to turn your body into a fat burner. So I know exercise in normal cases would be really great, and we recommend it, and we transition to that during that 3 weeks after we finish your weight loss program. But during HCG, we don't usually recommend you do that. Now, if you're an athlete, if you're training for something, if you really want to just continue to do exercise during those 4 weeks of weight loss, then I tweak your program a little bit for you so that it will accommodate and allow you to exercise so you don't get dizzy or pass out or hurt yourself while you're doing the program. So hopefully I answered that question for you, Alexis, and it's a great question. A lot of people ask that question. Next thing I want to talk to you about today is IV therapy. We have what we call a hydration station in my practice, and we're getting lots and lots of use with this hydration station. And I wanted to talk a little bit about it because a lot of people think an IV is only for when you're sick. We should have done it last week because I had all my IV scars, bruises. I'm kidding. But I had my IVs because I had my second vaccine, and I wanted to make sure that I was really well hydrated, and I got lots of good vitamins in me, so I had a really good immune boost and a really good start so I wouldn't get so sick. And I've been doing this actually for quite a while, but it is really a great thing to do before you have a coronavirus vaccination. We can put vitamins in it to help boost your immune system. We can just do bags of fluid. And I get a lot of questions from people, when else is a good time to do an IV? When else is a good time other than if you've just been sick, which is another great time, if you've had the flu, if you've had diarrhea, if you've been vomiting, if you've had COVID, anything. I know everyone looks at me like, the flu, does that even exist anymore? Yes, it does exist. And, if you've been losing a lot of fluids, a great way to get fluids back and to help you to feel better quicker is by getting some IV hydration and then getting some vitamins in that bag too if you want to, and we can push them all together, and it's very relaxing in my lab. I wish I had a camera that I could just walk you through the lab and show you, but we have the lights dim and music playing so it's comfortable. We have reclining seats for you so you can recline back when you get that IV and just kind of relax. I did have a couple of questions last week about, how quickly do we absorb this? And we do absorb fairly quickly. It takes between 60 and 90 minutes, depending on how hydrated you already are or how dehydrated you are, and to take a full bag of fluids. There is a rate, and our nurse knows, how fast we can push those fluids, and it does differ a little bit, based on age and health and that kind of stuff. So it does, like I said, take about 60 to 90 minutes to take a whole bag of it, but we try to make it super relaxing and a really great place for you. We have another question coming in. This is from Jeanette, and she says, can I have IV therapy help with, I'm screwing up your whole question, Jeanette. Jeanette, can IV therapy help me with dry skin? And that's a really great question because a lot of people think, does dry skin correlate to not being well hydrated? It absolutely does. And one of the things that I do, one of the tests that I do with my patients is squeeze like that. And if you squeeze and the skin doesn't pop right back to where it was, then you're definitely dehydrated. So dry skin that isn't, stretchy and placid, is that a word? Going back to its normal state when you pinch it, you would definitely benefit from hydration. A lot of sports teams, pre and post workout, it's a great way to have a better workout. I have a lot of athletes that come in and do it pre-game and post-game. So like I said, there's a lot of different uses for IV hydration, and our hydration station is getting a lot of use these days with COVID and the flu and all of those different things. Headaches is another one. A lot of people have headaches from dehydration. Don't really correlate the two. So hopefully I answered your question, Jeanette, and I've answered everybody's questions regarding IVs. If you are, like I said, getting over coronavirus or getting over diarrhea or vomiting and are dehydrated, if you just feel like you could use some more fluid, and no matter how much you're drinking, you can't quite catch up, getting a couple bags of fluid really helps catch you up, and then you can maintain that by drinking healthy, good amounts of water. I get this question all the time too. How much water should I be drinking, Dr. Deb? And the answer is half of your body weight in ounces. So for the ease of math, which those of you who know me, I'm not super awesome at math. If you weigh 200 pounds, you should drink 100 ounces of water. Another thing you want to really think of, and a lot of people don't know this, is that if you're eating a lot of sugar, if you're eating a lot of caffeine, that also dehydrates you. If you're exercising a lot, going to hot yoga, which is one of my favorite things, you actually have to drink more water than that. So I always say for every cup of coffee or every glass of iced tea that you're drinking or every Coke that you're drinking, you need to add an additional glass of water to balance that out for you. So hopefully I answered all your questions on IV hydration, and they were great questions on IV hydration. And I have one more thing I really want to discuss with you today, and it's orthotics. A lot of people come in and their backs are hurting and their hips are hurting and their knees are hurting, or their neck, and they can't correlate the connection between all of this and your feet. So this is really important because your feet are your foundation. Most everything starts from the base. I tell you this with your health too, right? Your gut is your foundation. So structurally, your feet is your foundation. So we have this really cool scanner. We can scan your feet and see how your feet are hitting the ground, and then how that impacts your ankles, your knees, your hips, your shoulders on up. And I brought with me today one of my flip-flop orthotics. I know a lot of people go, oh my God, orthotics, they can make you look like they're old lady shoes or old man shoes. Well, today we have really awesome looking flip-flops. We have orthotics that you can actually just slip right into a shoe, and they're not like they used to be. They're soft and flexible, and they're built properly to put you back into that neutral position. And summer is right around the corner now, and it's funny because not everybody can wear high heels. Like, who was it? Anybody remember back in the old days? Who was it that would wear high heels to the beach in those ads and movies? Annette Funicello. Am I dating myself with Annette Funicello? We wear sandals, we wear flip-flops, and a lot of us can't wear flip-flops because we feel like there's not enough support. This flip-flop is actually an orthotic. So this one was mine. We scanned my feet, and then they built the flip-flop to put me into the neutral position, to give me lots of support, but it's still nice and cushy, and it's pretty and blingy for those of you who like pretty and blingy. But there are also some that are just, woven rope or regular flip-flops. We have men's flip-flops. I should have brought my husband's to show you today. I didn't think far enough ahead on that one, but really nice looking flip-flops that are orthotics that you can wear to the beach, or you can wear in the summer when you don't have to wear them in sneakers, so that you can get lots of really great support. We have a question from Alice, and Alice says, how long does it take for custom flip-flops to be delivered? It's a great question, and it kind of depends on the time of year. In the summer, it does take a little bit longer for flip-flops to arrive, but typically between 7 and 10 days for flip-flops, or even for orthotics. And then we teach you how to wear the orthotics if you choose those, or the flip-flops. I know it's not that hard. You slip your feet right in and go. So good question, but typically 7 to 10 days. I have gotten them in as little as 3 days. So hopefully I answered all of your questions when it comes to orthotics and flip-flops and slipping them into the shoes. So go, don't hesitate, don't wait, because if we get your foundation built right, your foundation in your house, we don't want cracks and crevices in there. We want it to be nice and solid so we can build a better structure, so the rest of your body is balanced and even and neutral. And then the benefit of that is we reduce wear and tear. So if you're out of alignment, if your biomechanics are off, we get much more wear and tear in the knees and the hips on up. And if it goes on long enough, then we get arthritis, and then we get irreparable damage. So great idea to look into that. If you just can't figure out why your back keeps hurting, why your knees keep hurting, why you're plantar fasciitis, your feet keep hurting, it could just be that you need some good orthotic flip-flops or good orthotics to get your foundation right, and you'll feel a world better. So I hope this helps. If you want to contact me, you can contact me via email at feelbetter@lakepointwellnesscenter.com, or if you're like me, old-fashioned, you just like to pick up the phone and hear someone's voice at the other side, our phone number is 770-974-5215, and our website is feelbetterhere.com. I hope this helps. Until next time, love and light, health and happiness. Bye-bye.